Right, so Professor Happi, thank you so much for joining me. I'd love to ask to start with. So, as you know, the theme of the conference this year is invest in health, and that can mean so many different things to different people. And I'd really love to know from your point of view, what does investing in health mean to you?
I do think that investing in health, for me, is that fundamentally about investing in health research, because it's through health research that we understand exactly what health is. And we can actually learn from the health research to make the right type of investment. First of all, that's where it starts. It's not from investing in health research. But then, secondly, it's also about understanding exactly what are the health challenges. And understanding the health challenges enable us actually to find solution and make the right kind of investment. I mean, for me, I believe that, investment is not necessarily always about money, but it's always about, first of all, building what I call an ecosystem. That ecosystem will help us to actually galvanize our effort, catalyze our effort, and build a community of practices in health that will help us, harness what I'll call the experiences that are existing around the globe to make the world a better place. And for me, you make the world a better place when people are healthy. And as such, I think we need to deliberately make what I call intentionally, putting the resources into the aspect of health research, health education, health infrastructure, and every other things around it. So that for me, that is investment in health.
That's wonderful. Thank you so much. And I think it's really important for us to bring together diverse voices from across the globe to offer different perspectives at the conference this year. I know that you get invited to all sorts of conferences. So, what was it about Saudi's Global Health Exhibition that stood out to you and inspired you to travel around the world to take part in the event?
Well, I do believe that the conference was bringing people from different backgrounds, and then therefore that will bring different perspective. So, and then for me, I think it's an opportunity to meet and exchange ideas with others, and also an opportunity to learn from what is going elsewhere in the world. So, I think it's a forum where we're all coming together to learn from one another, and also to exchange experiences. We're coming from different backgrounds, we're doing different things, but I think it's a unique opportunity to come together and then kind of share and also learn. So I think pretty much that's what I saw there as something that is pretty unique.
Yeah, great. Thank you. And along those lines, we're bringing together so many different nationalities, as you said, and specialities to the show. What do you see as the importance of global collaboration in shaping the future of global health?
Well, absolutely. The global health is not called global health without collaboration and partnership. That's why it is called global health. Otherwise, you call it national health or whatever we call it. So I think global health actually requires collaboration. Without collaboration and partnership, then there's no global health. And then this conference probably, have the opportunity to bring people from different backgrounds. And then global health itself is not just one single discipline. Global health is a conglomerate it's transdisciplinary, and as such, I think it creates an opportunity to bring people from different disciplines, different background, working on different health thematics, coming together to exchange ideas. And then that creates the kind of melting pot that you need definitely for innovation. That's basically what I see here.
That's great. Thank you very much. And I understand that you're currently working on the African Human Genome Sequencing Program. Could you tell us a little bit more about this work?
Well, I just want to say that this work I think is a work that will add a lot of value to the future of precision and personalized medicine. The data from Africa are presently very scanty and not available in the global human genome databases. And then the reality is that, the human diversity in Africa hold the key to many of the health problems that we have in the world. And then therefore, it's important to have access to those data. It's important to mine those data. It's important to work with Africans in order to make sure that the data are available so that the world can benefit from the African human genome diversity and the data. For instance, just to be very clear, if we go back into either history or even into science, it is obvious that, human emerged from Africa and then dispersed from Africa and migrated from Africa to the rest of the world. However, it is also scientifically proven that only about 2% of the people migrated from Africa to the rest of the world. So, which means that they take very little of human diversity with them. the remaining 98% of people that remain in Africa, they do have the key to many things. And I want to just illustrate this by just a few examples. For instance, we all know that, the gene related to sickle cell is found mostly in African populations. And that really holds a key, for instance, today using CRISPR technology, then there's a cure for it. There are a few more, diseases out there. For instance, kidney diseases are often as a result of sickle cell, not sickle cell trypanosomia, human trypanosomiasis. And because of that, then there's a gene called APOL1, that actually is responsible for many of the kidney disease, and then that has been discovered in African population. And today, the advances actually trying to use that discovery to create drugs, against, kidney diseases. Another one that I can refer to is called ZRANB3. ZRANB3 is a genetic variant that was found in Africans, and that is responsible for what they call metabolic diseases. And because of that discovery, so there is a drug now that is being developed to solve, that problem, a metabolic disorder. That metabolic disorder that doesn't affect people of African descent, but affecting people globally. So it shows clearly by just giving you these two examples that, the African genome hold the key to many of the problems that we do have there. And it's important to, invest in making sure that those data are available so that it can benefit the global health community.
Well, it sounds like incredibly important and interesting work to be doing. Can you actually now just tell us a little bit about what people could expect from your session at the Global Health Exhibition?
Well, in my session, probably in the global health, I think for me, what I expect to share with people is actually to show the value of the African genome, but also the value experience that we bring from Africa, for instance, in the area of pandemic and epidemic prevention and response. We build credibility, we build a lot of track record in that space. And then we're also willing, more than willing to show how we've used innovation, creativity, and resilience, for instance, to really start setting up a system that can help us to respond to epidemic and pandemic in a way that wasn't done before.
Wow, Professor Happi, it sounds like it's going to be a great session and one that we really look forward to. Thank you so much for taking the time to answer a few questions today.
Thank you very much.